In this video, we're going to try to demystify the FIGO classification. The aim of this video is to give you a grasp of the big picture of how these tumors spread, rather than dealing with the nitty-gritty, daunting details of the FIGO classification. At the beginning, there are general rules that we need to talk about. The first rule is that stage 1 is always confined to the organ and is further classified according to its salient feature. If we're talking about the cervix, this is a very narrow passage, thus we are concerned about the size of that tumor, and the magic number we've got here is 5/7. When we talk about the endometrium or the uterine cancers, we're basically talking about the degree of invasion and whether the tumor has reached the serosa or the adnexa of the end of the uterus. When we talk about ovarian cancers, we're really concerned about the number of ovaries affected and the S feature that we're gonna further talk about in this video. Regarding stages 2 and 3, we're really concerned about the downward and outward extension, and stage 4 always represents the descent meds. Now, let's delve into the cancer cervix. Now, when we talk about cancer cervix, stage 1 is always confined with the cervix, and the cervix is a very narrow passage. Thus, the classification deals with the size of the tumor. The magic number is 5/7. If the tumor is less than 5 millimeters, we're dealing with stage 1A micro invasion. If it's more than 5 millimeters, then we're dealing with 1B macro invasion. And now, the micro invasion, if it's less than 5 millimeter by 7, we are really concerned about the micro size of that tumor. If it's less than 3 millimeters, we're dealing with stage 1A1. If it's more than 3 millimeters, so if it's from 3 to 5 millimeters, then this is stage 1A2. Regarding the stage 1B, the macro invasion, if the tumor is less than 4 centimeters, then this is 1B1. If it's more than 4 centimeters, then we're dealing with 1B2. Now, stages 2 and 3 usually are dealing with the downward and outward extension of that tumor. If we are in the cervix, a downward extension would go to the vagina and outward extension would go to the parametrium. So stage 2 represents involvement of the upper 2/3 of the vagina without any parametrial infiltration. Stage 2B represents parametric infiltration. Stage 3A represents involvement of the lower 1/3 of the vagina. Stage 3B represents parametrial infiltration or the presence of hydronephrosis or any signs of non-functioning kidneys. And stage 4 represents descent meds, and these descent meds are further classified into stage 4A, which represents descent meds to the bladder and rectum, the neighbors of your gynecological structure, or stage 4B, which represents tumors reaching beyond the true pelvis. Now, moving to the endometrial cancer, we have stage 1, which usually represents tumor limited to the endometrium and limited to the uterus, and it's further classified according to the degree of the invasion. If it's limited to the endometrium, then this is stage 1A. If it's if there is some sort of invasion to less than half of the myometrium, then this is stage 1B. If there is an invasion to more than half of the myometrium, then this is stage 1C. And we're really concerned here with the degree of invasion, to the level that if there is a serosal invasion or adnexal invasion, or there are any signs of peritoneal cytology, we move from stage 1 to stage 3A immediately. And now, the degree of invasion represents a very important feature of this tumor here, to the level that metastasis is not only confined to stage 4, but also there are pelvic mets and periaortic mets present in stage 3C. So, if the tumor is limited to the endometrium, this is stage 1A. If there is invasion of less than half of the myometrium, this is stage 1B. If there is invasion of more than half of the myometrium, this is stage 1C. Now, if this invasion reaches the serosa, this is stage 3A. If there is a downward extension of that tumor to the vagina, this is stage 3B. And the degree of invasion is very important here, to the level that if there are any mets to the pelvis or the periaortic lymph nodes, this is classified as stage 3C. Now let's go back and go chronologically from stage 1 to stage 2. Now, stage 2, as we've said before, stage 2 always represents a downward and outward extension. So if there is a involvement of the endocervical glands, this is stage 3A. If there are outward extension to the stroma of the cervix, this is stage 2B. And finally, stage 4 usually represents the presence of descent meds to the bladder, rectum, and stage 4B represents meds to beyond the true pelvis. Now, dealing with ovarian cancer, a very key concept here is that I want you to think of the ovaries or I want you to think of the ovaries as a machine, a Messel's machine. Now, these Messel's machine usually has ranges for their muscles. Now let's move to the classification, putting this key concept in our mind. Now, stage 1 is always confined to the ovary or the fallopian tube, and it's further classified according to these details. And a very handy mnemonic to remember these details is a mnemonic I learned from Professor May Rafat. May God bless her, because as it's important to give credit to those who taught you, it's also important to give them your blessings. And this handy mnemonic is stage 1A1, stage 1B both, stage C, 1C, CS. Stage 1A1, one ovary or fallopian tube is affected. Stage 1AB, both ovaries or fallopian tubes are affected. Stage 1CS, now we have the S features we've talked about here, and these S features represent stage CS1, surgical spell. Stage CS2 represents surface tumor, a tumor on the ovary or fallopian tube, or the presence of a ruptured capsule. And stage C3 represents malignant cells in the ascites or in the peritoneal washing. Now, stage 2 and 3 represents a downward or an outward extension. If we're talking about the ovaries, if there is an extension to the pelvis, this is stage 2. If there is extension to the peritoneum, this is stage 2. So the muscles here just reached the pelvis and the peritoneum. If the muscles reached the extra pelvis or the extra peritoneum, here we're talking about the retroperitoneal. I just said the extra peritoneal for the sake of simplification. If the muscles reach the extra peritoneum, which is the retroperitoneum or the extra pelvis, then we're dealing with stage 3. And if there are decimets, then we're dealing with stage 4. And these decimets usually go to the lungs, forming pleural effusions, or to the parenchymal mass like the extra-abdominal organs or extra-pelvic organs like the liver or the spleen, the inguinal lymph nodes or lymph nodes outside the abdominal cavity. And that was the end of this video.